Hey, Dr. B here, and now we're going to investigate the field of pharmacology, just an introduction, which can be thought of as the medicinal modes of action, effects, and uses, or perhaps just simply think of it as what makes a good drug if we're looking for desirable properties. Recognizing that most drugs are in the form of pills, but not necessarily so, we have to consider the percent of that drug that's going to enter the bloodstream. This is referred to as bioavailability. Once a drug is delivered, it enters its first pass. After that, it'll recirculate. If you're dealing with an IV medication, well, that's going directly into the bloodstream, typically intravenous, so 100% of it will be bioavailable. Orally, however, it's going to be less, since you have to get through the gut. If you're going to the brain, it will be even less typically, since you also have to get through the blood-brain barrier. Typically, this means you need a particularly greasy medication. Since most drugs are pills, let's have a little deeper look at that. Getting them to that receptor, and that is the typical mode of action. They are going to bind to a receptor. That can be a challenging thing. You have to get through the digestive system, and if you don't, they may be treated as food. You have to get through the defense systems, and they may treat them as invaders. And one way to deal with this is to consider Lipinski's rule of 5. This is not a comprehensive view of getting through all these pathways, but it does deal with a couple things. Most notably, it helps you make sure that your medicine will be not treated as food and will not be a brick. As a medicinal chemist, this was kind of our Bible. This helped you avoid all sorts of unnecessarily trials and experiments. You'd like to have some hydrogen bond donors, but perhaps less than 5. I don't really know why this says just less than 5. If you have 0, that thing is unlikely to be water soluble, but you don't want to have too many either. Very important is to keep the molecular weight below 500 grams per mole. Otherwise, it will get into the liver and be treated as food and get digested. You do want to have some hydrogen bond acceptors, but not too many. You want the log P, which is a measure of solubility, which I won't go into detail on, to be a decent value. And if you do that, well, then you will get into the bloodstream because enough of it will dissolve, and yet you won't be treated as food and just get all chopped up. These are known as Lipinski's rules of 5, and yeah, there's only 4 of them. So most are dealing with solubility or getting digested. Now, once you get into the bloodstream, there's all sorts of other issues that can creep in. For example, that drug may have undesirable side effects. It might lead to dependence or addiction. Have a look at the opiates in a later slide for that. Or there may be some drug-drug interaction, and that's complex, right? You may be taking some other drug at the same time, and they lead to an undesirable effect in combination. But if you've worked it all out, you are said to be in the therapeutic window. That's a good place to be. This is a formula that considers both whether it's going to be toxic and whether it's going to be effective. You'd like to maximize the effectiveness and minimize the toxicity. Usually these deal with ED50 and TD50. Historically, it also used to deal with LD50. And these are measurements of effective or toxic doses. Typical units are milligrams per kilogram of body weight. A nice thing about that is that it's not species dependent. So the effective dose would be for 50% of the population, or the toxic dose. You'd like that effective dose to be very low, perhaps in the single milligrams if possible. However, there's plenty of drugs, acetaminophen, for example, which may go beyond 100 milligrams for the individual medications. You'd like the toxicity to be very high. The toxic dose would be nice if it's not a low number. And the lethal dose is an infamous historical figure where they determined how the 50% being lethal to a given species. Ugh. So this can lead to the therapeutic index, where you compare the toxic divided by the effective. When you put the toxic on the top, then a very high number is a good number. It means it's very forgiving. A low number means it's very dosage critical. And Drugs can make it to market with a low therapeutic index, but it oftentimes means that it's for a very critical need, for example, for a cancer treatment. Okay, that's an introduction to pharmacology for medicinal chemists.